May the peace, mercy, and blessings of Allah be upon you. For the first time, we will conduct a practical session. Generally, I do not film or photograph anyone, and I prefer not to, but it has been specifically requested of me. In this simple video, we will begin by identifying the points for cupping therapy, Hijama, and learn how to locate them. We will also see how to perform Hijama correctly. First, the patient must be comfortable, either lying on a chaise longue or sitting on a medical chair, depending on the patient's physical condition. You must assess the patient in front of you. Do they suffer from hypertension? Do they have any illnesses? Ideally, the patient should lie on their stomach. For Hijama to be performed correctly, it is essential to prepare all the necessary tools: cups, scalpel, alcohol or betadine, gloves, cotton or tissues. Now all your materials are ready. I will then begin. The practice of Hijama starts by identifying the cause of the patient's suffering based on the symptoms they present, such as hypertension, diabetes, or test results. You examine the existing problems in the patient to determine the areas for Hijama to target. The identification of Hijama points relies on several elements that you can use during the session. First, you can refer to acupuncture points, also known as meridians. Two main meridians can be used to identify points on the back: the governing vessel meridian, which is located directly on the spine, and the bladder meridian, which runs on either side of the spine. Second, there is also the reference to neurological points, which concerns the nerves emanating from the spine and connected to an organ. Each vertebra gives rise to a nerve linked to an internal organ. For example, the C7 vertebra is connected to the skin and head, and the same applies to other parts of the spine. You can also use these connections in diagnosis by placing cups on either side of the spine, to the right and left, which ensures a very high healing rate. Third, the concept of referred pain, which refers to diseases or pains felt in an area other than their origin. This concept inspired Johann Bell's zones, according to which certain specific parts of the body, particularly entire areas on the back, correspond to a particular organ or are influenced by a given organ. For example, when you feel pain in the left side of the colon, it may manifest as pain or impact in the shoulder. Similarly, when the liver has a problem, such as excessive fat accumulation or enzymatic dysfunction, it can cause pain in the dorsal region, and so on. Now that you know how to determine the Hijama zones, it is not necessary to memorize all the points, but they can be easily identified through your knowledge or understanding of the acupuncture meridian lines located along the spine, as well as to the right and left of it. You can rely on recognizing the vertebrae such as C7, then continue to identify the other relevant vertebrae, T1, L1, S1, etc. Another method is to work on entire areas associated with a particular organ, as mentioned earlier. You can apply your work either by using the precise points mentioned or based on the influence points. In this case, you apply pressure along the entire spine to observe the patient's reaction to this pressure. Of course, you apply equal pressure without forcing and observe the patient's reaction. Is there pain here or not? We will start from the bottom up. Here, is there pain? No. And here? No. And here? Yes. There is pain at this spot. We will place a Hijama cup. We prepare a cup and position it on this spot so that the painful area is at the center of the cup. Then we perform the suction. So here's the first point. We repeat. Here, is there pain? Yes. This becomes the second point. Here, yes. This marks another point. Here, is there pain? No. And here? No. And here? Yes. This becomes another point. And here? Yes. And here? Yes. And here? Yes. If a cup does not stay in place due to the presence of hair, two options are available to you. Either use honey or medical Vaseline. Thus, we will have identified the pain points felt by the patient. You press, and if the patient feels pain at a spot, it becomes a reference point. These pain points can generally be a muscle calcification, known as a trigger point, or a dysfunction related to an organ, or a nerve point presenting a problem, causing pain in the patient. This point is often connected to a specific organ with an issue. Once the points are identified, we perform suction with the cup, which we leave in place for 1 to 2 minutes. Then we remove the cups, proceed with micro-incisions, and reposition the cups for another suction for 1 to 2 additional minutes. Finally, we wipe away the blood, remove the cups, and the hijama session is complete. When the 2-minute suction is over, we remove the cups and begin the micro-incision process. These micro-incisions must be made in the longitudinal direction of the body tissues to facilitate healing. This must be done with a scalpel blade number 11. We remove the first cup and begin the longitudinal micro-incisions. Rule: in most cases, the more incisions there are, short and parallel, the better the effect and result. Areas where the skin is folded must be well stretched so that the micro-incisions are straight and the patient does not feel pain. We have now completed the longitudinal incisions with the scalpel blade number 11. The cups are left in place for 1 to 3 minutes. Once the 2 minutes have passed after the incisions and suction, we remove the cups and proceed to disinfect the affected areas in this way. We carefully remove each cup like this. We have now finished removing the cups and clean the hijama areas. For this, you can use medical compresses, betadine, hydrogen peroxide, or saline solution. These products help disinfect the areas where the cups were applied. And thus, the hijama session comes to an end with the selection of points, the method of their determination, the correct incisions, and the disinfection after the session. After hijama, the patient must rest for a day or up to 72 hours. Sexual intercourse is prohibited for 72 hours. It is advised to avoid spicy foods containing chili or dishes prepared with a lot of tomato, onion, garlic. The patient should also avoid intense physical effort or excessive fatigue. May Allah teach and protect us, you and us. Peace and blessings.